Hello, student. Good evening to all of you. I hope all of you are doing good. So, this session, as you know, we are doing the Fmge recall session. So here I am going to discuss the recall question of physiology. Hi, good evening, Dr. Jitin. So, what I will do, I will show you the questions that has been recalled by some student. So if you feel that any questions option need to be changed, so please let me know. I'll do change the option. And if you also think that stem of the sum of the questions is not correct, please do share me in the chat so that we can update the question. And after receiving all the input, the final questions will be uploaded in the PrepLadder app. So that is the ultimate target of this session. I hope all of you have done good in the exam. So now, without spending much of the time, we'll directly go to the questions, and I will tell you the probable answer. I'm not going to discuss much because all of you know, okay, because this is a session which is the recall session and the most probable correct answer that we want to understand from here. This is not a regular session where you want to learn something about physiology, right? So we will directly go to the questions. So hello, Dr. Ritesh. Hello, Dr. Jitin, all. So we are going to discuss the recall questions of physiology. You will see that there are a couple of questions. So those questions we will discuss here. And please do let me know if you think that stem of the questions or the options of the questions was different. So please inform us, right? So the first question here. So as you can find out here, the question is pretty straightforward. Which of the following regulate the body temperature? And I'm 100% sure that all of you have done correct answer in these questions. So the answer of these questions is nothing but the hypothalamus. So hypothalamus is the important part which is responsible for thermoregulation. Okay. So if you have followed my last LRR that that was for the FMG student. So in that LRR session also, okay, I have discussed this part, right? So see here in the LRR for the FMG student, which I have taken in the YouTube under this PrepLadder platform. So there we have discussed various nucleus of hypothalamus. And I told you in that session that this nucleus of hypothalamus is very, very important. And in that session, I have also discussed that this hypothalamic nucleus, that is anterior nucleus of hypothalamus, is responsible for hot, and posterior nucleus is responsible for cold response, means cold environment, the response in the cold environment. So the pretty straightforward question and the pretty straightforward answer. So which of the following regulate body temperature? Hypothalamus, right? So I hope all of you have done correct answer in this question. So 1 marks is there, right? Okay. So let's move on to the next question. Yes, it was there in the earlier, right? Okay. So the next question. Now, this question is a long stem. So here I want your input because some of the students are saying that presentation of these questions or this patient was a little bit different, right? So let's see. 62-year-old patient brought to the emergency department following a suspected stroke, right? So upon assessment, this is the most important part. It is noted that the patient is able to speak fluently. Now, some of the students are saying that patient was not speaking at all. So there was no speech from the patient. That was the symptoms. But some of the students are saying that patient was speaking fluently, but the words uttered lack coherent meanings and lack understanding. So there is lack of understanding also, and it is a fluent speech, right? So this was the typical question that was given according to many students. Okay, not able to talk and he can understand the main content. See, so if so I'm telling you, so please do recall and please let me know if the question is that patient is not able to speak, patient is not able to speak, right? And he can understand, then the straightforward answer of this question is Broca's aphasia, right? Broca's aphasia. All of you know this thing because motor part of the language is the Broca's area, right? Unable to speak, right? So most of you are saying the unable to speak. Then the straightforward answer to this question is Broca's aphasia. And this topic I have also discussed in my LRR session. If I can show you the LRR image. So this is the LRR that I have taken for you in YouTube. And there I discussed that this is one of the important topic for Fmge examinations, where I told you that this Broca's area is responsible for speech production, and this Wernicke area is responsible for understanding. So whenever you are saying anything or hearing anything, it will pass through the Wernicke area, right? So if the Wernicke area is destroyed, then the patient's Broca's area is intact, and Broca's area intact means the speech will be fluent. That's why whenever we classify the aphasia, so there is this kind of classification which I have shown you in the session, that there is non-fluent aphasia and the fluent aphasia. So if you are, all of you are saying that the question was that this patient is not able to speak, not able to speak, then this is a non-fluent aphasia and the Broca's area is the answer. But if you are saying that the patient is speaking fluently without understanding, then the most probable answer is the Wernicke's area. Although conduction aphasia can also be the answer, but in conduction aphasia, understanding will also not be there. So I'm going back to the question once again, right? Okay. So if this is the question which I have put here, then according to this, Wernicke area will be the answer. But because all of you are saying that the most probable question was not able to speak, then the Broca's area will be the answer. Non-fluent was mentioned, right? Very good. So non-fluent was mentioned means the typical answer will be Broca's area, right? So this is not the exact question, I believe. So this was not the exact question, because many of you are saying that patient was not able to speak, non-fluent aphasia. So Broca's area is the answer to the question. Great. Okay. Chalo, let's see. So this was the second question. Now coming to the third question. Now this third question, again, this was there in the LRR session. Okay. So as you know, I told you that in Fmge exam, some of the topics are very, very important. So this JVP is one of the important topic, which is also important. And in my session, I have shown you this diagram. I have shown you this slide rather than diagram. This is slide. So where I told you that there are many prominent abnormalities of the JVP that you have to remember, like prominent A wave prominence, A wave, canon A wave, absent A wave, large V wave. And along with that, I also told that sharp Y descent and sharp X descent is also very, very important. And here it is written tamponade. So cardiac tamponade, there is a sharp or prominent X descent is there. And from there, the question was asked. So here is the questions. Which of the following JVP findings is typically associated with the cardiac tamponade? I told you that prominent X descent was answer. So prominent X descent is the answer of these questions. So whatever, even if the heart sound was muffled was added, so I'll write down here, the muffled heart sound was also there. Muffled heart sound was also there in the stem of the question. And they asked that which of the following is typical finding of cardiac tamponade. So prominent X descent is the answer to this question, right? So here the prominent X descent I have shown you in my last session. Great, Dr. Narendra. Okay. So now the next question was an image-based question, hopefully. So you all look at this question and tell me if this was the similar question or not. So here this F, they were asking what is indicated by this point F. So F, as you can see here, this is a normal spirometric diagram where this is the tidal volume. Okay. Then the patient is taking a deep inspiration. So whenever the patient is taking a deep inspiration, so this extra part, this is the inspiratory reserve volume. Okay. And this is one extra part, which is known as the expiratory reserve volume. So if you add up this all three components, then F is nothing but your vital capacity, or the forced vital capacity was not there. Okay. Okay, it was not there, no problem. So if this was the image in the question, then the answer will be forced vital capacity. But as you are saying that it was not there, no such question. Okay, then leave it. Okay, then leave it. Okay, fine, perfect. Now another question according to recall was like this. So look at this question once again. Which glute, skeletal muscle and adipose tissue has which of the following glute? So basically this is a very regular question, very simple question. No question such, okay? We generally read about this kind of question and this kind of topic always, because glute is very, very important topic in the all kind of examination, right? Insulin dependent was mentioned, then it was more easier. So insulin dependent was mentioned. Okay, as you are saying. So insulin dependent GLUT, as you all know, that this is the GLUT4, right? GLUT4. Or if the question was like this, that which of the following GLUT is present in the skeletal muscle or adipose tissue, then also similar answer will be there, that it is the GLUT4. Again, GLUT4 I had discussed in the last LRR session only. So that's why you should follow at least the LRR session, which is free in the YouTube. And in my last LRR session, when I was looking back that what I was discussed and what was there in the questions, as you can understand, more than 60% questions was from the LRR session only. So here we have discussed this GLUT4, and another slide also I have shown you in LRR session, that this is nothing but the insulin dependent GLUT, right? So all of you know this thing. This is a very simple question also, right? Okay. So we are going to the next question. So this was another question according to recall, that central vein have which type of cell in the center. Now this is a topic which is not discussed in LRR or not even the rapid revision also, but similar topic we have discussed. Like for example, we have discussed that in the blood vessels, you know that there are two kind of blood flow. One is the laminar kind of blood flow and one is the turbulence blood flow. So when in the large vessel, when the laminar blood flow is going on, you know that the velocity of the blood flow is maximum at the center and the velocity is lower. Velocity is slower towards the periphery of the blood vessels. Because of this highest velocity at the center, you know, all the RBC or all the blood cells, okay, all the RBC mainly, not the WBC cell, they aggregate at the central part or central stream of the blood vessels. So RBC are RBC are going to be aggregated at the center of the blood vessels when the flow is a kind of laminar flow. Got it? So in these questions, the answer is going to be the RBC. So I hope all of you also have done this answer correctly. This is an, easy question. If you think of this question also, you'll be able to answer, because the RBC numbers are very, very huge and the velocity of the blood flow is maximum at the center. So most of the RBC will be aggregate at the central stream, right? So this is the RBC answer. Now another question. So this question is a little bit, a different type of question. See, this is a very common thing, that which a patient has decreased iron level and taking iron medication, which of the following decreases iron absorptions from the gut? Okay. Yes, so you have answered T. T is the correct answer here, but I'm not sure whether the fourth option was meat or something else. You know, okay, because some of the students are saying phytate was also in the option, but phytate also reduces iron absorptions. But even if phytate and T is there, so T is the better answer, because all of you know that this amla and lemon, they are not going to be the answer. Okay, so if the sprout is there in the option, okay, if the sprouts are there in the option, then obviously the T is going to be your answer. So tea, phytate, caffeine, these are the substances which are going to reduce the iron absorptions. And this amla, lemon, all this contain vitamin C. Vitamin C, you know, ferric iron ko ferrous mein convert karke, it helps in the iron absorptions. So this is not going to be answer. Option D, I believe meat was not there in the option. So if the even the sprout is also there in the option, then your answer is going to be the T, right? I hope all of you have given correct answer to this. Sir, it was not central vein. This was mentioned venule. Still the answer will be same because, you know, even the venules and vein, the blood flow is a laminate type of blood flow. The velocity of the blood is very, very high in the arch of aorta. So there a kind of turbulence flow can occur. So because veins are the vessels where the velocity of the blood flow is low. So turbulence blood flow chances is less there. So that's why even if the venules is also there in the question or the vein is there in the question, the answer will be same. So I'll change here that rather than veins, you are saying that venules, right? So that I can correct the question later, right? Phytate was there. Phytate if was there, no? Then phytate can also be answered. But again, between phytate and T, it is better to choose the option D, right? Because that's a very known factor. T caffeine, they reduces iron absorptions. Okay. So this was the question. And another question, I believe this is the last question that was asked from Pure Physiology. So here the question was dynein protein. Now this dynein and kinesin, these are the protein which I have generally discussed in my lecture class in the non-muscle physiology. Because this dynein, you must have heard dynein and kinesin, these two protein. Although I have not discussed these two protein names in the LRR session because this is a little bit a kind of difficult question which is generally expected in INI-CET type of examination. That's why I skipped this thing. But again, they're asking this dynein and kinesin, right? Kinesin protein. So these are the protein which are helpful for transport within the cell. Mean basically these are the protein which are responsible for intracellular transport process. Intracellular transport process. Typically, they are responsible for axonal transport. So within the axons, within the axonal cytoplasm, the transport process is based on this kinin and dynesin. Not only within the axonal cytoplasm, any cell transport within the cytoplasm means if you want to transport one organi from one part of the cytoplasm to the other part, then you require transport protein. And which are they? They are dynein and kinesin. These proteins are known as a molecular motor. These proteins are known as a molecular motor. So the best option in these questions will be transport protein, intracellular transport protein. Exactly. No, they are not the transmembrane protein. They are the, okay, very good. So they are the motor system. So they are known as a molecular motor protein. So if motor protein was there rather than transport protein, then that is far better option even than that of the transport protein. Getting, doctor? Okay. So Dr. Guru or whatever your name, kinin, dynesin, okay. So they are basically not the transmembrane protein. They present within the cytoplasm, right? Intracellular transport, or better is the molecular motor protein. They are the motor protein. So best option to choose here, either transport protein or motor protein. Very good. So I'll cut this. So all of you are saying the motor protein was there in the option, and that is the best for dynein, right? So this was the correct answer. I believe that these are the questions which are asked from physiology. The total altogether I have counted, total 8 questions are there from physiology. And if you have watched my LRR session, at least 5 questions has been asked from this LRR session, right? So I hope this is all from the physiology. If you remember any other questions which you feel that has been asked, okay, please give your input in the chat boxes and I'll put that question. Okay. Some accident at reticular excitation system. Okay, so some of you are saying that one question was there on reticular system. Patient had road traffic accident or some accident and now cannot sleep. Reticular exciting system, reticular inhibited. So please try to do recall these questions. Okay, so I have to check whether that hypothalamus related some question is there or this question is typical reticular activating system. Please do recall and give me input. But road traffic accident, yes, I can understand that some question was there regarding road traffic accident and cannot sleep. So I have to look at the options because sleep is regulated by obviously the reticular activating system is also there, as well as the hypothalamic center is also there. So please, all of you do recall and let me know what was the option. Even if you remember 2-3 options, I can put that question in the final thing, right? And I will share in the PrepLadder app. Right, sir, not fluent not fluent so that is 100% correct that it was a Broca aphasia, and I have changed that question. So it was not Wernicke, it was Broca aphasia because non-fluent was mentioned and all of you have told that patient was not speaking at all. This was, okay. Reticular excitation, reticular inhibition, amygdala inhibition. So patient cannot sleep means basically the reticular excitation जब होता है then our cortex remain awake, right? So when cortex remain awake, you will not be able to sleep. So cortex has to be okay, suppressed. So when the reticular activating system is inhibited, that means you will go for the sleep. And there are certain neurotransmitter from there, norepinephrine, serotonin from the reticular nucleus. So patient is not able to sleep means the reticular activation system is awake. He is just giving input to the cortex, and cortex is remaining awake, and that's why patient is not able to sleep. So in that cases, the reticular excitation of the reticular system is leading to awake. Okay, so that will be the answer of this question. I believe, Dr. Guru, if this is the correct option, that reticular excitation, reticular inhibition. So reticular inhibition means the patient will go for sleep, and reticular excitation means the patient will remain, right. Exactly, reticular excitation hoga, and that's why patient is not able to sleep, right? Okay. Calcium channel question was also there. Sharka was also question. Okay. So Sarka is a very, very common topic, and I have discussed in many of my session. But again, please do recall these two questions. Sarka. Okay. So I'm writing here. If anybody could recall what was the question, that Sarka. So Sarka is basically is a pump. Okay. Active pump which mop up the calcium from cytoplasm. But I believe that was not the question. Ill-type calcium channels. So that is also related to this same thing, but I believe you try to recall, and please put the question correct options with correct option in the chat box so that I can include the question in the final document, right? So this is all about physiology questions. So altogether total 8 question was asked, and I hope all of you have done great in physiology per se. Okay. So best of luck for all of you. I hope all of you will do best in the final result. Okay. So for the timing, bye bye. Take care.